Hello, everyone. Good evening. It's currently 5 p.m. West African time here. Um, I don't know how many people are on this live, but if you're on this live, please do well to leave a comment in the chat box. I think the chat box should be available. Yeah, but if you're on this live, please leave a comment in the chat box. Tell me your name and tell me where you're chatting from so that I would, hail you and all. So, guys, I've realized that a lot of us have, like, there have been a bit of break in communication, right? So basically, yeah, I think somebody just joined. Please make sure to leave your name in the comment section so that I can, call it out, give you a shout out. So your name and where you're chatting from. Yes, thank you. So I can't even remember when last I went live. I think if you ask most YouTubers, they will tell you that live videos are usually very nerve-wracking, in the sense that it is very unpredictable. You don't know how your live videos would go. But I actually like, okay, sure, Joshua Silas chatting from Bielsa. Thank you so much, Joshua Silas. I really, really appreciate. Please do make sure to, share this link. Share it to your family, share it to your friends, share it to everyone. We are going to be talking about med school and YouTube. So if you have any questions for me, please leave it in the chat box and I'll answer your questions. Thank you so much, Joshua Silas. Yeah, so a lot of YouTubers will tell you that this going live thing is very nerve-wracking, in the sense that you don't know what to expect. Like I said, like you might think that you might think your life is going to be interactive, but there are a lot of questions that us YouTubers ask. Will people join our live? Will it be engaging enough? A lot of questions. So that's why a lot of us tend to avoid going live. But I love having one-on-one conversations with my subscribers. I realize that our subscriber family has been growing, although I haven't been posting regularly, and I will get to that. I hate using medical school as an advice, because most of the times I believe that most people do med school and they do YouTube and they are doing really, really well. So that shouldn't be an excuse. So please, if you're joining my live, please just indicate in the comment section your name and where you're chatting from. If you have any questions for me, please do well to, leave it in the comment section and I'll answer it. Yeah, if you're just joining my live, please leave your name and where you're chatting me from, so that I can, hail you. So just leave it in the comment section. Don't forget to like this live. Please like this live. Like this live. Thank you. I was just talking about how for us YouTubers, we don't like going live because we always ask ourselves, are people going to join? Is it going to be engaging enough? And how long are you going to keep people engaged? Like, there are a lot of intricacies. A lot of things can go wrong in live videos and stuff. If you can hear me, please type your name and where you're chatting from. Don't forget to like this live. Please like this live. Yeah, so I'm going to be talking about med school. Actually, this live was supposed to be for the questions that I usually receive on my YouTube channels from my subscribers. That was what this live was supposed to be for. I mean, we're supposed to address some of the med school questions that a lot of people have, because I've gotten a lot of questions about how to cope in medical school and all of that. In case you're just meeting me for the first time, I'm Aniekan of Aniekan MD, and I am currently a medical student studying in Nigeria. Yeah, I think that's the PRS. Or what else do you want to know about me? Yeah, if you're just joining my live, please drop your name in the chat box, like this live, and tell me where you're chatting me from, so that I can, I can hail you. Thank you so much for joining. So basically, I've gotten a lot of questions from, junior colleagues and things. A lot of people are struggling as to navigate, especially that transition, right? Because here in Nigeria, how the medical school system works is that it's usually 6 years of training. So you have your first year. Here in Nigeria, first year is more like secondary school stuff, but more advanced. So I would say advanced. Yes, let's call it advanced second. Okay, what level are you? Oh yeah, I'm in 400 level now. Yeah. Okay. Hello, thank you, Medic Legit. Yes, good evening. Welcome to my live. If you have any question for me, please leave it in the chat box and I would answer you. So, what was I even saying? Okay, yeah, I was describing how the system works. So, for the first year, you're basically doing like advanced secondary school stuff, right? Please, if you're just joining my live, please leave your name in the chat box as well as where you're chatting me from so that I can hail you in the comment section. Thank you, Medit Legit. You didn't tell me your name, so I'll just be calling Medic Legit because that's what I'm seeing here. Good boss. Okay. Your name, I so much love. Okay. I'm trying to follow the chat at the same time. Please, if you're just joining my live, indicate your name and where you're chatting me from. Don't forget to like this video. Please like this video, guys. Like this video, indicate your name and where you're chatting me from. Then you can drop any questions you have. So I was explaining that we have first year is more like advanced secondary school stuff, or advanced high school stuff, like some people will call it. So after that, there's a transition to 200 level. 200 level, you start doing your basic medical sciences. You start doing anatomy, physiology, biochemistry, right? For some schools, they write exams in 200 level. My school, we don't write exams in 200 level. You write your promotional exams in 300 level, which I did. So you are going to do anatomy, physiology, and biochemistry all throughout 200 level as well as 300 level before you write the exams that will decide whether you move on to 400 level or not, right? So a lot of I've got a lot of questions from junior colleagues as regards that transition phase, right? Where you're transiting from 100 to 200 level. A lot of people are confused, like they come in confused most of the time, just as I came in confused. But I don't like to say I came in confused. I was privileged. Please, if you're just joining my live, indicate your name and where you're chatting me from in the chat box so that I can, give you a shout out. Thank you. And don't forget to like this video. Don't leave this live without liking this live. Please like this live, and leave your name as well as where you're chatting me from in the chat box and any other question you might have about medical school and YouTube or me self. You can ask me any question, then I will try as much as I can to answer. So I don't like to say that I wasn't privileged. I was actually privileged. Like I had senior colleagues that I could easily talk to and ask whatever question. So I came into 200 level very prepared. So one thing I'm realizing that some of these junior colleagues, they don't have like anybody that they are I don't want like to use the word mentorship, but they don't have like senior colleagues that they reach out to, which is wrong. When you're transitioning, it's very important that you have like mentors. I don't like to call it mentors or thing, but it's very important that you have like people that are guiding you through the process. Um, okay, please. It seems like some people just joined and just left the live. Please try as much as you can to share this live to as much people as you can. Like this video. Thank you so much. Thank you so much for joining this live because I was really considering. I didn't do publicity for this live. I just did something like a poster posted on my YouTube as well as my WhatsApp, and that was just it. I didn't do a full-on publicity, but you guys are here. I really appreciate each and every one of you for making out time to join my live on such short notice. Like I said, it was just something out of the blues. So a lot of people don't have that support when they are transitioning, which is wrong. Please, if you're just joining my live, please make sure to write your name in the chat box as well as where you're chatting me from. Then if you have any questions, then I would answer it. Thank you. Okay, I had one here. My name is Tangod Franklin. Thank God, Franklin. Thank you so much for joining my life. I really appreciate MBBS UNN, and I so much love your channel. It has given me updates both on academic and non-academic. I love you so much, and thank you for sharing Prasad chemistry in one of your videos. Oh my God, thank you so much. Thank God, Franklin. You are a real G. You're a real subscriber. I'm sorry, you're a real subscriber. For you to even know, like, I actually recommended her. From what you said, I know that you've been following me. Thank you so much for watching my videos. Thank God, Franklin. Yeah, if you have any other questions, you can ask me, then I'll try my best to answer. Thank God, Franklin. How has school been? How is UNN? Um, I just hope you have been able to pick something from my channel at least. So if you're just joining my live, please make sure indicate your name and where you're chatting me from. I would like to know. So that's what I was saying. So they come in confused. That's why I have some videos on my channel, like trying to help people settle in. To be honest with you, when you come into 200 level, the advice I usually give, please, if you're just joining my live, please indicate your name as well as where you're chatting me from so that I can hail you. I can give you a shout out, name, where you're chatting me from, and if you have any questions, you can also indicate it. Please share my live. Please share my live. Okay, my name is Ali. Welcome, Ali. It's nice having you here. Please, if you have any question for me, let me know and I will try my best to answer. Please like this live. Thumbs up, like this live, like this live. Thank you. So, guys, what was I saying? Yeah, that's the thing with the breaks in trans. I just have to be saying this because we are getting new people joining our live. So, if you're not joining my live, please indicate your name and where you're chatting me from so that I can shout out. I can give you. Okay, my name. Okay, I mean my name is David. I mean David. Hello, David. Thank you for joining my live. I really, really appreciate. I really, really appreciate. Thank you so much for joining. Thank you. So, um, guys, what I was saying, once you just transition, it's a bit, it's a shock because you start learning new terminologies and new things. For my school, funny enough, the transition phase, we have like a tutorial group that comes like to teach you, like kind of give you a bit of what your 200 level is going to look like. So it really helped a lot, honestly. Like they call it Elite Tutorial. Yes, Elite Tutorial has been doing a lot. It was headed by Bath. Yes. He's a student like us. Like he has been doing so much, like so much good for us. Like he would come and he would teach and give you a bit of experience as to what to expect. So I'll just say that once you get into 200 level, just get the ball rolling, like from the first day. Like you have to get the ball rolling, like because medical school is a lot. It's too much. It's voluminous. It's very stressful and very time consuming. Like at the end of the day, you have a lot of, if you leave your work till the end, you have a lot of, if I catch that dog barking, even if it doesn't, wow. Actually, I didn't know that you guys heard the dog barking. I'm sorry. I'm sorry. I can't control my environment, guys. Um, a lot of things happening around here, but I'm really sorry about that. Yeah. So, I was saying that once you get to 200 level, you have to really. Sorry, my name is. Who is this person playing with me? Who is NRG DBD play? Sorry, my name is Aniekan. Who is this? I would like to know who this is. Please, if you're joining my live, indicate your name and where you're chatting me from. If you have any question for me, leave it in the comment section and I will try my best to answer it. So, when you come into tutorial, you have to really set the ball rolling. I usually say, okay, tutorial level is like enjoyment phase. You try to, is adjustment. Yeah, you're adjusting, but at the same time, you have to really enjoy and maximize that phase because I think it's one phase where you're relatively free. You're relatively free, although you still have a lot of things to cover. Don't get me wrong, but in comparison to other levels, I would say 200 level is where you're relatively free to explore, free to try different study method, free to, you know. Sorry, Isaac. Hmm. Who is this that is playing like this? You told me your name was Ali, you told me your name was David, you told me your name was Ali, now you're telling me your name is Isaac. Which is it at this point? Um, please, any recommendation for physiology you used during your MB prep? Yeah, for physiology, for MB, I used essential physiology. Essential physiology, I think, is one of the best thing that have happened to us basically because it has, if you, okay, like for example, now that I'm in 400 level, I was able to recall some things because based off of what I read. Essential is actually a good book. Forget what people say. Essential is actually a good book, and I would recommend Essential Physiology. I know it looks very big and voluminous. Actually, for MB, what I did was I selected. Okay, I read Essential, yeah, but I went in each system. I knew from past questions what are the questions that are frequently asked from the past questions. Those was what I read in each topic. So when you come to, for example, let me pick a system that, mm, let's pick cardiovascular system, for example. I know cardiac output is usually asked, like they can ask you to write an essay on cardiac output. I know that shock, circulatory shock could be asked. They can ask you to write a whole essay on circulatory shock. I know that which other arrhythmia, sometimes they could ask it, sometimes they will not ask it. And I knew that heart failure could be asked in MB. I knew that hypertension, for us in our school, hypertension, they love that topic so much. So what I did was I tried my best to um, read these topics in this format. So if I go to a system, I'll just check past question. What are the questions? What are the topics? What are the topics under a system that I usually ask? And that is what I try to read first. When I covered the whole book doing that method and I still had extra time, I could now go back again. And like I said, if you follow me, you know that when I read, I hate jotting. So, which is a bad thing, but it helped me to be fast during MB. There wasn't time to be writing anymore. I just had to, you um, I just had to, sorry. Okay, somebody asked, um, please, any text. I hope that answered your question. Thank God. I hope that answered your question for physiology. Or do you have any more question for me? I hope that answered your question. Okay, Francis Umomo. Is that your name actually? It sounds like an Akwa Ibom name. Anytime I see my Akwa Ibom people, I feel very happy. If you're just joining my live, please indicate, tell me your name and where you're chatting from so that I can give you a shout out, as well as any questions that you might have for me. So Francis is asking, I'll just go with Francis because that's what I can see. Is asking any textbook recommendation for internal medicine. Well, for me, um, yeah, the book I read for medicine is actually two, but I haven't really had time to fully explore. Okay, yes, it's my name. I'm not quite sure. Okay, okay. What tribe? Now I'm really interested. I'm really interested. That is if you're comfortable telling me your tribe. So I haven't fully explored internal medicine yet, but what I realize is that I like two books actually. I like Kuma and Clark. Kuma and Clark is a beautiful book, and Davidson. I actually had Davidson first. Davidson is more summarized. Um, so and because I don't really have so much time, actually our class notes are very from Delta. Okay, okay, I can get where the name is coming from, more like South type name. Thank you so much. So I like Kuma and Clark. Kuma and Clark is very detailed in comparison to Davidson. Davidson is now a bit, it's also detailed, but it's how will I put it? It's more condensed, right? And it has all the important stuff. So if you don't really have time, go with Davidson. If you have time, I'll advise you to go with Kuma and Clark. But for me, the two books I like now, Kuma and Clark, number one, then Davidson. Although that is if you have time, right? For us in our school, our some of our lecture slides are very comprehensive enough. But if you want to read anything, you can also supplement with Kuma and Clark or Davidson. But for us, like I said, some of the slides are actually comprehensive, so we don't really have to, read textbooks. I hope that answers your question, Francis. I told you the books that I love for internal medicine. If you have any question, please type it in the comment box. And if you're just joining my live, please write down your name in the chat box so that I can give you a shout out. Welcome, 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 welcome. If you're just joining my live, write down your name in the chat box. Like this live, please. Like this live. And okay, yes, thank you. I'm so happy I could answer your question. If you have any question for me, leave it in the chat box and I will definitely answer it. So those are the two books, but there are other ones. So there's Harrison. Harrison, that one is if you really I used to say Harrison. Me personally, I don't like Harrison. I don't know, maybe if I get to final year, I'll like it, but I don't. Okay. Okay, yes. Thank you so much, Francis Momo Ajirogene. I hope I pronounced it right. Did I pronounce it right? Ejirogene. Yes, I think that's how it's pronounced. Thank you so much for joining my live, Francis. I really, really appreciate. Please don't forget to like, share this live, and if you have any question for me, leave it in the chat box, and I would answer it. Okay, so there's Harrison, but I think Harrison. I for me personally, I don't like Harrison because it is more in depth. It doesn't have for me. I like reading books that have pictures because I see. I'm also a visual learner, so sometimes I like to feast my eyes. So Harrison doesn't have a lot of like beautiful diagrams, but it's a more detailed book. Some people say you should go with Harrison. It's very detailed, honestly. But I think Kuma and Clark is where it lies. Kuma and Clark has criterias. And in medicine, there are some things like Framingham's criteria, like Dockett James criteria, Dockett Jones criteria for infective endocarditis. Like that, there are some criteria that you need to know. And I think Kuma and Clark actually has that. Davidson might not have some, right? But they also have some guidelines. I know those things are very important. Like cardiologists, they don't joke with the Framingham's criteria for congestive heart failure. They don't joke with it. If you want to make a diagnosis of congestive heart failure, you would have to prove using the Framingham's criteria. But anyway, if you have any more questions, please leave it in the comment section down below. Mm. So back to what I was saying, guys. So there's this shock, but like I said, just start from 200 level, hit the ground rolling, try as much as you can to study every day. Honestly, that is what I struggle with, especially now in this 400 level. I struggle with studying every day because it's a lot. I have to study. I think for us to fully understand what I'm saying, I'll just give you a brief um summary of how my schedule kind of looks like. So for us in my school, in 400 level, you do medicine, surgery, pathology, and pharmacology. And your pathology is divided into four. So you do histopathology, or what some school refer to as morbid anatomy. Then you do chem pathology. Then you do microbiology. Then you do hematology. Then, like I said, you also do medicine and surgery, which is important, right? Now, how it works for us, or how our system works, is that you have medicine and surgery in the morning, usually 1 hour each. Then you go for your hospital posting. Your hospital posting is usually okay. Let me give you a time frame. So we have like medicine 8 to 9, then surgery 9 to 10. Then you now go for your hospital posting from 10 to 12. Then you come back, and depending on the course you have, some courses will start immediately, but normally there's supposed to be a break. But in our school, sometimes they don't even consider the students at all. Like they will just start the classes. So when you come back from your hospital posting, you might be having either hematology, microbiology, histopathology, or um chemical pathology. Like each day you must have one of your pathologies, and it depends. Like for example, now histopath, sometimes they can teach you from 1 till 6 p.m. and they don't mind. They will keep you there seated and teaching you. And sometimes you can have lectures from like 12 to like 2. Then from there you now go and do your practicals, which can last till 6. That's how it works. So we are running simultaneously medicine and surgery as well as part and farm. Then, like I said, your hospital posting, you do M0, medicine 0, and surgery 0. Then you do medicine 1. Medicine 0 is 4 weeks, surgery 0 is 4 weeks, medicine 1 is 8 weeks, and surgery 1 is 8 weeks. The same thing, medicine 2 is 8 weeks, and surgery 2 is 8 weeks. So you spend the whole 8 weeks, and you are rotating around different units. Okay, like for medicine now, I've rotated around pulmonology, cardiology, endocrinology. Yeah, I've rotated around these three units. Then for surgery, I've rotated around through general surgery, colorectal specifically, although we saw different cases. And yeah, I'm currently doing my surgery 1 posting. So I'm to start my new rotation, I think is in oncology. So yeah, that's how it works. So somebody's okay, Francis, sir, concerning knowing symptoms for disease, I just started 400 level. Sometimes you collect patients and don't seem to have any diagnosis. How do I overcome this? This is a struggle for us because both of us, we are in 400 level now. We are struggling through it together. Just that the good thing, right? When you collect a patient, what you can do is to go home and like read up those symptoms. You could Google basically, or go to your textbook and read up those symptoms. Um, then try and come up with a diagnosis. You don't know much, especially in M0, S0. I'm sure even them too, they expected that we did not know much because we just came. But some units will expect you to like come up with a diagnosis, expect you to think on your feet. But you can't, you don't know it, you don't know it. But if you know, what I would advise you to do is that know each system and the symptoms that they usually present with. Like for cardiovascular system now, you know what you're asking now, whether there's dyspnea, orthopnea, um paroxysmal nocturnal dyspnea, whether there's intermittent claudication, whether there's easy fatigability, whether there's cough. Even cough too can be a cardiovascular, especially when the patient is presenting with cardiac failure. So there's cough with productive sputum. You know that when you hear any form of sputum or discharge, right? Because sometimes it's maybe when you're doing genitourinary system, you might have to ask, is there any discharge? You know, for those kind of questions, you have to ask the color, the smell, the amount, the um is it really associated with any time of the day? But normally when you ask color, amount, smell, it kind of paints a picture of what's expected. But like I said, just know each symptom for each system, right? Once you know that and you are able to okay know that this symptom is for this system, you can now go to your textbook and ask, or your phone basically, and just ask like, okay, if the patient presents with this, then you present your patients to your consultants. Like us, we have consultants, we have registrars. You present to them, then they will correct you basically. They don't expect you to have a spot on diagnosis, right? But another thing that helped me is that I knew some common illnesses. Like when you're coming into a unit, it's good you know some of the common illnesses that are in that unit and how they present. Like for pulmonology that I had a lot of people that had TB, COPD. So I kind of understand that for TB, I have to rule out contact with chronically. I have to ask whether the patient had contact with chronically coughing individual, whether there's history of drenching night sweat, whether the patient consumes unpasteurized milk. I know I had to ask that, and even if I want to like present TB, I have to make sure all of these are in my this thing, in my history, in order to be able to defend it. Like for now, they don't expect you, at least for now, since you're just starting 400 level, they don't expect you to have a spot on diagnosis. But as you progress, they want you to have spot on diagnosis. Funny enough, but for now, they don't expect you to have spot on diagnosis. They just expect you to have an idea. Like they just want to know that you are thinking, right? So just that's it, honestly. I hope that answers your question, Francis Umomo. If you're just joining my live, please tell me your name and where you're chatting me from. If you're just joining, tell me your name, where are you chatting me from, so that I can give you a shout out. Francis, I hope I've been able to answer your question. Yeah. To be honest, you get better. You get better with practice. Click more, examine more. For us, we're expected to examine. Click more, examine more. The more you read, the more you get better. If you want me to tell you some of the materials, I can tell you in this video. Just leave it below in the comment section. Okay, that surgery period, is it practical? Basically, the 1 hour I said for medicine and surgery in the morning, they are for theoretical, they are just theoretical. So they teach you different cases. Like for surgery, they can teach you intestinal obstruction, they can teach you acute abdomen, they can teach you growing masses, hydrocele, varicose, all of these things. They'll just come and teach you all those things. The ones that are practical are is the one that starts by 10. So like I said, 8 to 9 is medicine, 9 to 10 is surgery, then from 10 to 12 is clinical posting. Clinical posting depends on where you are at. So our class is divided into different, because medicine is broad now, there are different specialties, and surgery too is broad, there are different specialties. So basically, our class is divided into different specialties. So some people will be in surgery, some people will be in medicine. Then at the end of the, if it's M0, S0, at the end of the 4 weeks, you swap. At the end of the 8 weeks, you swap. At the end of a particular time, everybody swaps. So people in medicine come to surgery, and people in surgery go to medicine, so that you have experience of both fields. So that's how it works in my school. If you have any other question, please leave it in the comment chat, and also tell me your name and where you're chatting me from. Yeah. Okay, I'm David Medic from Osun State University Medical Student Association. I'm also a YouTuber and I'm a huge fan of your work. I've been following you for a while now. Keep up the good work, sir. Thank you so much, David Medic. Oh my God, it's as if I have a community, legit. I can say now. Oh, can you see me? Sorry, there was a break in transmission. I really hope that I'm still with you guys. Um, Thank you so much, David from Ocean State University. I really, really appreciate. Thank you so much for sticking with me. Okay, yes, we can. Thank you so much. I'm really sorry that I haven't been consistent in my posting of vlogs, of sit down videos. The things I don't know what you guys are interested in. It's as if my vlogs kind of, it does better sometimes, but sometimes too it doesn't do well. So I'm like confused. Do people want vlogs or do people want sit down videos? And vlogs for me can be hectic to film. For me to film is not even hard sometimes, it's to edit. And medical school is medical schooling. Like it's like things just get tougher basically. Now I'm even struggling to catch up with schoolwork. But if I can, any free time I can, I'll try and create vlogs for you all, and as well as maybe I think I'll start doing sit down videos, because I think sit down videos are easier to film. I just have to sit down and basically talk. But yeah, tell me, what do you guys want? David, what would you want? Do you want me to do, to try doing more vlogs? If I film a vlog and a sit down video, would you watch it? Yes, I think that's a better question. If I film a sit down video, will you watch it? And if I film a vlog, will you watch it? Yeah. I mean, Francis Umomo. Yes, sir. Thank you. I can also read Kuma and Clark for the symptoms you have gotten from clicking. Yes, you can actually use Kuma and Clark, honestly. But for me, what I do is that, Suarez era. Okay, I'm a video editor. I can edit your videos for you for free. Oh, thank you so much. Thank you so much. I don't think I'm at a okay. I don't think I'm at a point where I can hire yet. Um, for now, I'm still a one-man squad. So, but thank you so much for offering. Honestly, can do more sit-down videos. Okay, so you would watch it, Francis, if I do sit-down videos. Yeah, for me, Francis, what I was saying is that yeah, I do read Kuma and Clark for my theoretical like internal medicine, but like yeah, you can also find based on your symptoms and things. But have you heard of the guide? The guide is a beautiful book. The guide is a beautiful book. Which other book again? But the guide is gold, honestly. Like some people don't know it, but the guide is gold actually. The guide has summaries of different clinical conditions, common clinical conditions. And I think if you're just starting, you should get the guide, honestly, just to have bearing of the common clinical conditions in different units. You can get the guide. I think most schools, if you ask around, I'm sure you can find it. Even online, if you go to Telegram pages, you might actually find the guide. Yeah, so just download that, Francis, then go through. If you're starting a unit, like if I'm starting nephrology now, I'll go to my the guide and I'll try and look at common cases. Just that, internal medicine for us, I don't know how yours works, so but for us, like internal medicine is so intertwined. Like they see almost everybody at the same time. Like you can have endocrinology, right? They're managing a patient with an endocrine disorder, but the patient also has a heart condition from the endocrine. So we now have cardiology handling that team. So, and what I notice is that it's more like the knowledge in medicine is more centralized. I don't know how to put it. Endocrinologists, they have idea of cardiology, right? Internal medicine, they'll tell you internal medicine. So they can also manage patients with heart conditions too. Like it depends on the team that is available, basically. Although we have specific teams that see these patients with this condition. So yeah, but the guide is a good place to start. Yes, I have the guide. Yes, that's a good place to start, honestly. Exactly, it's very intertwined. It's very intertwined. Like you can be clicking. Like before, I used to go with a mentality that I'm in pulmonology. This patient must have a respiratory disorder. Until I go there and the patient is telling me symptoms of maybe acute kidney injury, or he's telling me something that has to do with so I have difficulty breathing, or and I'm having swellings on my leg. You're telling me something that has to do with CVS in recipe. So everything is so intertwined. You just have to, like find a way around it. Since you're just starting, they won't expect so much from you. But make sure that every day you're learning. Have you started teaching you guys examination yet? Because that's another thing. Like that's what's and that is another thing you have to know. Try doing more vlogs. I know vlogs can be very stressful. I'm a preclinical student, so if you do sit down videos that related to my level, I would watch. Okay, David, I understand. I understand. I think I will do that. I think I will do that. I will try doing more vlogs, but if I'm unable to do more vlogs, I will just do videos related to preclinicals, because a lot of people have been asking me questions, and most of them are from the preclinical arm. I never thought that people would join my live, guys, because like I always felt that if I started doing live videos, I wouldn't have an audience. But you guys have been very supportive and helpful. If you have any questions, please leave it in the comment section. I'm still answering your questions. If you Yes, though examination was from surgery post internal medicine focus on history taking. Okay, yes. Basically for us in my school, we have for our M0S0, you are just solely to focus on history taking, right? So you need to know how to take good histories, and you know that you only get better at history taking with practice. Even myself, I don't think I know how to take my histories properly yet. Although I just average, like I'm not yet stellar. There are some histories that you hear, you're like, wow, 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 right? So I'm not yet stellar yet, but I'm just like average. I just need to like keep doing it. I'm sure I'll get better at it. But when you get to M1, S1 for our school, that's when they want you to do examination. They want you to do history. They want you to do examination. They want you to give diagnosis in in our M1, S1. Then when you come to M2, S2, they want you to do like. But funny enough, right? M1, S1, sometimes they can ask you what investigations would you do. When I was even in surgery, self, my S0, they were asking me how will I, for my end of posting test, they were asking me, they wanted to ask me how would I manage fracture. Like, how would you manage a fracture? That was so, although they had to, they just remember that, this one is just S0, let's just leave him. But yeah, um, but the examinations are not so different to actual, okay, except if you're examining specific parts. Like I know that surgery now, they want to, if you want to examine breast lump, or you want to examine any form of lump, there's an order where you check for the shape, the size, the is it the fixture, is it fixed, is it mobile. You have to check for all these things. Then for medicine now, but I think surgery also does, they have similar examination now, respiratory, CVS. If it's systemic exam, I think they have similar examination. Yeah, but yeah, just try as much as you can to just get better with it. Try practicing more, try practicing on your friends, try um practicing on patients. But yeah, if it's history you're doing, just focus on history, right? To be honest, you get better at your history taking with more conditions that you know. That is the truth. If you don't know, or more pathologies, yes, if your pathology is good, like if you have good understanding of pathology, you wouldn't have so much of a problem. Like if you've done most of your pathology, which I know you haven't since you are just starting, right? You won't have any problem because you would have covered all the diseases, right? But since you haven't done that, like I said, nobody expects perfection for you from you at this point. So that is it about my schedule. Oh. It's looking like most people have even left the life. Um, are you guys still here? Can you guys see me? If you're just joining my live, please leave your name as well as where you're chatting me from in the comment section so that I can give you a shout out. Um, if you're seeing me, could you just maybe put an emoji or something in the comment section so I know? Okay, yes, sir. Okay, thank you. Thank you so much, Francis. So back to what I was saying. What are some of the things that I'm learning in this new phase? Because like things are changing. I had to write down things because I knew that doing this live videos are usually very long, and you'll be talking for a long time. You'll be talking for a long time, and like I said, you just don't know what to expect. Okay. If you're just joining my live for the first time, please leave a comment in the comment section down below. Don't forget to like this live, like this live, like this live. So, some of the things that I'm learning is how to be kind to people, basically. Mm, I feel like you become the doctor you want from now. Some people used to say, oh, when I graduate, this is how I'll behave. When I graduate, this is what I will do when I graduate. But I think you start being a doctor from now, honestly. The kind of life you want to imbibe. And that is why I'm saying, like, for me, I still feel sad that I'm unable to achieve some certain things that I really want to. Like, for example, now okay, if you just joining my live, please indicate your name in the comment section down below, and so that I can give you a shout out. If you have any question for me, leave it in the comment section down below. So like I said, you become the doctor you want to be from now, right? um you try to find that balance from now, which is something that I haven't found yet. I really wanted to inculcate exercising, like I wanted to join the fit farm squad and all of these things, but it hasn't really been feasible. But I have like classmates that are actually able to inculcate this into their schedule. So like I said, you learn from now. What kind of doctor would you be? Even like how your interaction with patients, when you go to clinic, do you find it to be another regular exercise, or do you find it to be a chore? I like to see it as an opportunity that these patients are giving me to listen to their problems and maybe better help them, right? It takes a lot for somebody to like open up and tell you, this is what is wrong with me, this is what is wrong with me, even especially when the person knows that you can't really do much, right, in their treatment, right? But that thing is also a lie, because medical students, right, they really help a lot, honestly. They help consultants a lot, they help registrars a lot, because whenever you take a detailed, we are the ones, medical students are the ones that take detailed, very detailed history, like even what is not even necessary, a medical student will ask it, right? So if the any of them, maybe the registrar or whoever, forgot an important part of the history, the medical student would get it. Please, you're just joining my live. Comment down below your name and where you're chatting me from so that I can give you a shout out. If you have any questions for me, please leave it in the comment section. Okay, so back to what I was saying. So yes, I think I have another question. I think I'll just answer this real quick. Sir, how do you cope with stress of year four? Because there are days I don't read because of stress, while when I'm chanced I happen not to read. That is what I'm currently going through now, Francis. So I don't even know whether I'm even the best person to give you an advice, right? The stress is enormous, but some days you just have to sleep, you just have to rest, you just have to allow yourself to rest, because that was what I wasn't doing, and I fell sick. And the worst thing is, if you fall sick, I fell sick, and I had to like, I still went for my posting. I went for my posting, but I had to tell them that I told my consultant that, ma, please, I can't. Like, I can't. I'm having fever. I can't stand. I don't think I'll be available. And they were very nice to me. Like, they allowed me to go. They were like, oh, sorry, yes, you really need to take care of yourself. Honestly, take care of yourself. If you don't take care of yourself, you end up falling sick. And the time that you would have used to even um study, you now waste it on giving yourself a whole amount of rest. So basically what I'll just say is that some days are like that. Just take it like some days are like that. Some days you will not be productive. Just say, okay, it's a rest day, then tomorrow will definitely be better. But if you feel well rested, please go for it. Honestly, like I said, every day for me, every day I try to read something, even if it's very small. I try to watch videos, like movies, like trying to relax myself, because like I said, yeah, I'm sure you're also going through it. Year 4 is very stressful. It's too much workload, so you just have to like find some sort of balance and rest when you can rest. Or some people say, oh, I'll rest during the weekend. You can rest during the week. They come back from school and sleep. You mustn't wake up in the night to read. You can actually sleep. You mustn't tomorrow you wake up in the night to read. Like, try to take rest days for yourself. I used to say that if I collapse, nobody med school will continue. People will continue. So that's it. That's my advice. I hope that answers your question, Francis. Thank you so much for engaging so much. Thank you so much, Francis. Can you recommend YouTube channels for parts and far? For pathology, mm, there's I Love Pathology on YouTube here, and there's Dr. Gibran. Dr. Gibran's lectures are straight from Robbins. I Love Pathology too is also straight from Robbins. Dr. Gibran's lectures are longer, like even if each video is shorter, but when you look at it, it's long in comparison to I Love Pathology. So there is that. Um, but if you're looking for something that's not on YouTube, you can watch Patoma videos. Just go on Telegram and search for Patoma. Patoma videos is good for pathology. Then for pharma, I know there's this. I've forgotten the name of the channel. Speed Pharmacology. Speed Pharmacology is a good channel, but I haven't really found a channel like that does. Okay, Speed Pharmacology, Ninja Nerd is also good, but like I said, I haven't really found a channel that's solely dedicated to pharmacology that does a very great work, to be honest with you. Mm, yeah, but that's what I can recommend. Any more questions? Any more questions for me? So, yeah, that's it. Like I said, it takes a lot for patients to actually tell you details. Like, okay, there's some patients that have even like opened up and told some of us some things that they didn't even tell the doctor. Like, what I'm just trying to say is that you start becoming a doctor from now. Just try to be kind to your patients. Remember that these people are in a lot of pain. Like some people just want to just go click and get out, but you have to be empathetic, right? You go there, you understand that they're in pain and they are still sharing these important details with you. So try to be asking them, oh, are you comfortable in that position? Do you want me to go and come back? Are you okay? Are you okay enough to speak? Do you need me to do anything for you? Are you sometimes don't ask that, don't ask, do you need me to do anything before they will ask you for money. I've had patients ask me for money, ask me for bread. So don't ask, be careful what you're asking. But like I said, just try to show that you are concerned about their condition and you're not just here to take history and run away. So that is there. Then I've also realized that this medical school, you just be chasing knowledge. I'm telling you, Francis, like some people, some patients, they'll ask you for bread, they'll ask you for money, they'll ask you for a lot of things. Me, I have to, those kind of patients, I used to remind them that me too, I'm a student, I don't have money, oh, I'm broke, oh, like, and this history I'm taking from you is to better help your management, so that if in case there's anything the doctor miss, I can tell him and they'll correct it. You will meet a lot of patients. There are some patients that are rude. There's some patients that they don't like students. They don't want students coming around. There's some patients that are you just meet a lot of people. But in those situations, remember to be empathetic. Remember to be kind. Remember to speak well. Remember to understand that these people are too pain, and you're not the only one that have come to ask them for history. Because I noticed that, especially in teaching hospital, you have like 10. You can even have like 5 students coming on different occasions to ask one patient history. It's exhausting because they are from different team. And I told you one patient can be managed by cardiology, endocrinology, pulmonology, gastroenterology, infectious disease. They can all be seeing one patient and they'll be sending their respective students to that same patient. So some of these patients are exhausted. They are really exhausted. So just imagine the fifth person. I'm like the fifth person. I'm coming to say, Ma, please, I would like to take your history. I would like to conduct a physical exam on you. They will even tell you that, please, my son, other people have done it already. There is no need for you to do it again. But you now have to start explaining, oh ma'am, I'm sent from another team. I'm not actually with cardiology team. I'm with endocrine team or infectious disease team or rheumatology team. So you have to also see from the standpoint of the patient. So try to be nice to them and be kind to them. Then, like I said, I'm also learning about chasing knowledge. Over here, nobody cares about anybody who, like in clinics, like if you don't show that, actually this one I actually learned it since, if you don't show that you're interested in gaining knowledge, if you don't ask questions during rounds, if you don't, like me, I don't usually ask questions during rounds like that, but except if I have questions really to ask you. But really, I don't really ask a lot of questions, funny enough. But that's why I like being in groups where I have people that ask a lot of questions, right? But if I have any question, definitely I'll ask. If I see something that I don't know, any drug that I don't know, I would ask. If I see maybe one equipment I have not seen before, I would ask what it is and what it is for. So try as much as you can to ask a lot of. If you don't ask a lot of questions, if you don't show you're interested, some consultants will not really teach you. Like they will not rate you at all. They will just how will I put it? They'll teach you when they want to teach you, right? Like they will not go over and beyond. But if you are a type that is inquisitive, they'll want to, like, they'll be like, oh, this guy is actually this girl is actually interested in my specialty. I should teach him more. I should show him more. So yeah, I've realized that you'll be chasing knowledge here. And from the medical team of doctors to manage your case, yeah, the popular line by all medical students when they are going to clerk. So I'm from the medical team, I'm here to manage your case, blah 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 blah. But when you're doing this, please just remember to be kind to them. And another thing again is that I've realized that this medical school is also about confidence. You might not know what you're doing, but when you if if you show any sign of how will I put it, confusion, or I don't know how will I put it, if you're not confident, basically your patients can actually read you. Your doctors, like your consultants, your senior reg, they can read you a lot. So for me, at least I used to act, so I know how to pretend. I know how to please, if you're joining my live, please type your name in the comment section down below so that I can give you a shout out. Like this video, please, like, thumbs up, like this video. And if you have any question for me, please put it in the chat box. So like I said, you can, your how you feel can be read by your patients, by even your doctors. So sometimes you might not know what you are there for, but you just have to exude confidence, right? There are sometimes that I'm going to a patient, I really don't know what is wrong, but the confidence, like, okay, don't worry, I'll try as much as I can to figure this out. I might not know it. I'll be like, okay, I would have to speak to my superiors about this. Like, don't go there and be looking confused. Don't go there and be like fidgety, like you don't know what to do. Patients will instantly know that you are, they'll just know that you are just wasting their time. So sometimes what they need is just for you to reassure them, right, that they will be fine. That's just it. Although, like I said, you don't have so much knowledge enough to like properly treat somebody or tell somebody you'll be fine, honestly, but you just say, I hope you will be discharged soon. Honestly, like that's what I say, and they actually feel very happy about it. So like I said, just go with confidence, hang your stethoscope, go like you know what you're doing with your pen touch. Listen to their heart if that gives you more confidence. Listen to the long feels. What are you hearing? Even if you don't know what you're hearing, it's okay, you've heard something, right? So like I said, a lot of things have to do with like confident persona and all of that. Sometimes if you might even be spewing rubbish, but your confidence will just sell it, right? So that's one thing I've been learning here. I'm learning your confidence matters a lot. Nobody wants a doctor that is not confident. They want a confident doctor, somebody that actually looks like he can give hope. Yeah, that's it. So if you have any more questions for me, leave it down below. Also trusting God, definitely. I feel like for every level, I am learning to adjust and adjust and adjust and adjust. Sometimes it gets very exhausting, right? You're consistently adjusting, but that's how medical school works. Like from one level to another, you have to just adjust to fit the new level. If not, and for you to be able to easily like do this, you would need God most of the time. Sometimes you're not even prepared for some tests, but maybe God comes through for you and they move the test or they cancel the test, or God just gives you a sense of direction. I can't underestimate the essence of God. Honestly, I've seen God's hands in different aspects of this new level. Like every day I just pray, and sometimes God's favor in the eyes of my consultants, in the eyes of my professors, they will just see me and they just like me, or they just like how I approach things. So, or what I say sounds very intelligent to them. So, at the end of the day, you have to trust God and pray that God comes through for you. I had to write down some things so that I don't forget. But if you have any question for me, please type in the comment section, guys. I'm looking forward to reading your questions. If you have questions, if you have any question, you type your name too and where you're chatting from, so that I can give a shout out. Francis and um David, I don't know if you're still on the call. And thank God, you all have been amazing. Thank you so much for being on my call. Do you have any questions for me? Okay. Do you have any? Thank you. Thank you so much, Francis. Thank you. Do you have any question for me? Do you have any question for me? Question for me? So, another thing is that, right? I've talked about finding God. Another thing is that medical school is exhausting. Medicine is exhausting. Medicine is tiring. Medicine is frustrating. Um, it gets to some point of exhaustion. Some people will say, um, isn't it your passion? Isn't this what you wanted? But it's see that I feel honestly, like, let's not lie to ourselves. Even if it is your passion, it doesn't mean it can't get exhausting. Even if it's something you wanted, it doesn't mean it's it doesn't mean that every day is going to be all rainbows, flowers, and sunshine. Um, Sir, please, do you have a schedule for live so that I can engage the next time? Not really, not at all. But anytime I'm having live, I think I'm going to put it up on my community post maybe a day before. I think a day before, so that you can at least see. Yeah, you can see when I'm coming live. So I think next time that is what I will do. This one I just did it spontaneously because I was like, let me just do something for my subscribers. Because I really enjoy talking to you guys. You guys don't know how much I love meeting with you. Anytime that I find a subscriber, especially in my school, that walks up to me and tell me, oh my God, I watch your videos, they have been very helpful, I feel very happy and I feel very fulfilled. Mary T, hello, what is happening to Unijust? Meeting for 200 level. What is happening? Like, what do you mean, Mary? Have they resumed? Yes, 200 level have resumed now. 200 level have resumed. They have been in school for some time. Yeah, because I have friends too in 200 level. So 200 level actually have resumed. That is the 200 level medicine. They have resumed. So 200 level have resumed, 200 level have resumed. In fact, everybody have resumed. Okay. So if you have any more questions for me, please. They haven't given direct entry admission. I don't know if you have an idea. Um, I think they are still processing it. I'm not sure. I honestly don't have full details. But I know that there was a time where they had to close the hostel because they wanted to give more admissions. So I don't know whether the admission process is all done now. Um, I really don't think it's all done now, but to be honest, I don't have rock solid idea about it. I don't really have rocks on it, but I don't think I think they are still giving admission actually. So okay, thank you so much, Mary. If you're just joining my live, please leave your name as well as where you're chatting me from so that I can give you a shout out. If you have any questions for me, leave it in the comment section and I would answer it. So another thing is loneliness. You know, I used to say that people who I used to hate the idea of going to university in the same place where your family are. But now I think of it and I'm like, that is foolishness, honestly. Like if you want to stay in hostel, fine. If you want to get your own place, fine. But at the end of the day, like the loneliness here is insane. Because I'm not schooling in the same place as where my family are, it gets really lonely. It gets really lonely, especially when maybe your classmates are saying, "Oh, for the weekend I'm going back home," and you don't have your own home is maybe hostel or your house. There's no home. There's no family. It's really exhausting. So the loneliness is there. Honestly, you just get lonely. But at the end of the day, it just comes once in a while, sha. Once in a while. So I was telling you about how medicine can be very exhausting. It is exhausting, to be honest, very very exhausting. But even if it's your passion, if it's not your passion, it's exhausting for everybody. But some people say remind yourself why you started and all of that. I think it's possible for you to fall out of love with medicine, right? um Maybe it's what you wanted and during the course you just get exhausted and drained. But one advice I would like to give to people is that you have come so far, you have come very very far, except if it's life threatening, right? Like medicine is making you suicidal. That's when I will say, please, oh, just leave this course, just leave it. But if not, I usually say that you should just keep pushing, keep striving, because medicine is too broad. Medicine and surgery actually is very broad. Even if you don't want to work in clinical practice, even if you don't want to see patients, you hate the idea of surgery, the idea of blood, you hate it. There are other fields in medicine. There's community medicine, there's research. You can go into research, you can go into laboratory medicine, the pathology, the pharmacology. You can actually go into that, have a master's if you want to do that, or you can go into residencies for that. Yeah, you can do that if that's what you want. You can get a master's, you can get a PhD, you can go into research, you can go into how do they used to call this thing, media. You have seen doctors that host their own talk show now, they talk about health. You can go into biostatistics, that is under community medicine, or public health. I think the actual name is public health, right? Where is biostatistics, epidemiology, collecting data. You can go into this. I used to say that this field is so wide, it's so vast. For you, just try and get this degree. Then once you're done from this degree, you'll be fine. Is it very possible for a medical student to juggle a business alongside med school? Yes, it is very possible. It's absolutely possible. One of my classmates did that and she even had a distinction. Like, she doesn't know, I don't know where she's on this live. She doesn't know how proud I am of her. Like, she was, but for you to do that, you need support. You need time management. Like your time management has to be very good, because in as much as I had friends who did businesses and they passed, I also had friends who engaged in other businesses on extracurricular and failed. So it's a two-sided thing, right? There are people that do it and pass and people that do it and fail. Just know yourself, and if you have the right support, why not, you'll be able to do whatever it is that you want, right? The issue now is if you don't have support and you don't really know yourself, you can end up in problems, a lot of trouble. But like I said, it starts with knowing yourself. I give you an instance now. One of my friend, she had distinction and she had a business, right? She was doing a business in school. Even us that were doing business, we're not doing business. We did not even have distinction. Then the other end of the spectrum, people doing business also failed. So it just depends on you, and yeah, that's it. Hope I was able to answer your question, Mary. If you have, how do you mean support? Okay, when I say support, I mean support from friends, support from family. Okay, when I say support from friends, sometimes it depends on the kind of business actually, right? But sometimes um you might need friends to explain concepts to you, maybe because you were more invested in your business. Those are, medicine is a very jealous cause. They want you to be there every day, but maybe you could be very busy in your business and you are unable to, you know, um attend some lectures, which I wouldn't advise anybody to do. She didn't do that too, actually. She didn't do that. Or you need somebody to run your um if it's an online store now, to manage the online aspect, basically the communication aspect, the public relations aspect. You need somebody to be able to, or even to manage the orders, like the orders you are getting, because sometimes you might not have the privilege of always being online because you have to study, right? So things like that, you need friends. For friends in medical school, you need friends in medical school to better explain concept to you, people that understand. Okay, you have a business that you're running, right? So that, if you're unable to understand the key concept, you will not have to beat yourself searching so many textbooks trying to find answers. These people can easily explain it to you. I just hope that I'm being able to paint a picture of what I'm saying when I say you need support from friends, even from family too. You will need support. For you to actually succeed in those kind of endeavors. You really need good support and good people around you. Hope I was able to answer your question, Mary. Does anyone have any question for me? It's getting late over here, actually, but I still want to answer some of your questions. I've really enjoyed this live. I really don't want to go. Do you have any questions for me? Any questions for me? Any questions for me? Any questions? Um, Thank you so much. You guys really made this live very lively. I say lively. You actually made this live fun for me, honestly. I'm so happy that I was able to come on here and speak to each and every one of you. I'm so happy I was able to connect with you guys, because that was something that I was really scared of. I was scared of people not coming, not people not joining the live and all of that. But you guys turned up. Thank you so much. Um, Thank you, Francis. Thank you, Mary. Thank you, David. Thank you. Thank you, NRG, DBP Plays. Thank you, Joshua Silas. Thank you, Thank God Franklin. Thank you guys. Honestly, you guys really made this live very interesting for me. If you're just joining my live, please leave your name and where you're chatting me from in the comment section so that I can, hear you. You guys really made the live very lively. Like you didn't give me a lot of stress. I could just keep flowing and talking. Do you have any other questions for me before I end the live? I'm still going to be here. I think I'll end the live in the next like 8 minutes. So quick, speed, rapid fire. Going forward, right? I'm thinking of doing more vlogs, more sit down videos. I will try my best, to be honest, but if I'm not posting, just know that if you're just joining my live, please leave a comment about, just type your name and where you're chatting me from. Don't forget to like this live, please. Like this live, like this live, like this live. I'm going to try as much as I can to do more vlogs, more sit down videos. Though it's quite tough, to be honest, but I will try my best. If I'm not posting, just know that medical school has done its worst again. um yeah, but aside that, I'll try my best to post as much. Mm, but I would like to know, Francis, like, how has your experience been? You said you just started 400 level. How has your experience been so far? How has it been? I'm so happy I could relate with you because how has it been? How has it been? How has it been for you? I'm really interested, honestly. I don't even know if you're still on the live. Is there any of my videos that stood out for you? I would like to know. Like, it's been fine. Oh, morning class is trick. That is how life is. So, but I trust that you're adjusting really fine and really well to it. Um, is there any of my video that stood out to you that you would want me to recreate, or you want me to, do a spin on? Is there any video? Because I would like to assume that most people on my life are like my family, my subscribers. So I'm just asking, is there any video that was, apart from farm classes, hasn't been really holding? Oh, I'm sorry about that. Just try to use it as maybe as an opportunity to watch videos online. You can watch videos online, honestly. Francis, more like, would you mind telling me the school that you're you're at, or if that's too much for you? Is that too much for you? Do you mind telling me the school that you are in? If that's too much for you, you don't have to tell me. But if you're comfortable telling me, you can tell me the school you're in. If you're just joining my life, please type your name in the comment section, as well as where you're reaching me from, so that I can give you a shout out. Unical, wow. Is a very strong school. University of Calabar. It's a beautiful school. Most of my cousins are there. Yeah. Don't worry, it's going to be fine. I'm sure you're going to do very well, because most of my family are not, they are very smart people. Most of my subscribers, when I say family, I'm referring to you guys, though, my subscribers. Most of you guys are very intelligent people. I'm very, very sure. If you're just joining my live, name, where you're reaching me from, so that I can give you a shout out. I have 4 minutes left. So what do we do? What do we do? You can ask me personal questions too. Let's just make it a bit spicy. You can ask me personal questions. Mm. Anytime I say you can ask me personal question, I'm usually hesitant because I'm like, what are you going to ask me? But yeah, okay, I have 3 more minutes to go. I think I should go live more. What do you think? Do you think I should be going live more? If I'm going live, maybe every weekend, would you be joining? This is another question I want to ask. Like, if I'm going live every weekend, would you be joining in on my live? If you'll be joining in, let me know in the comment section. So that your video and textbook you used for part 1 MV, this really stood out for you. For me, thank you so much, Francis. Actually, when I was even making that video, like, I had a bit of nostalgic feeling, because I was teaching from a place of experience. I was listing the books from a place of experience. I'm so happy it stood out for you, and I think a lot of people got help from it. So yeah, thank you so much, Francis. Maybe I would do a spin on it, but the thing is that now that I've left that level and everything, like, my knowledge base is quite different. Okay. Um. So I have 2 more minutes left. The summary textbook for anatomy visual I'm saying really helps. Yes, that book was a very beautiful book. Most of those books that I recommended, I had to dig through hell, like to find them, because I keep saying like I don't like I don't like jotting, so I had to find summary books. So I'm happy that it was able to help you. Yes, select. I know, I understand what you're saying. I'm really happy that I was able to help you. So I was asking that if I'm going live every weekend, would you be open to joining my live? Let me see. Let me get real time feedback. Maybe I'll go live again. I don't think I'll go live tomorrow, but maybe next week I'll go live again. Depending on the feedback. So if I'm going live every weekend, are you open to joining? Honest opinions now. I don't know. Are you guys still on the live? I see you guys have gone. I wish you could do a video for A4 textbook. I really hate jotting, so I'm really slow in writing, so it slows me down. Yeah, I'm considering doing that, but you know that I'm still going through A4 now, and my how will I say it? My opinion changes. Like how I feel about a textbook now might be different in the next 2 months. So, but I'll just maybe I can just tell you textbooks that I'm using now. Maybe it will be of help. For histopaths, the textbook of choice is Robbins. So when I don't have time, I read basic Robbins. Then if I have time, I read Robbins and Cochrane, like the big Robbins and Cochrane, because Robbins has Robbins and Cochrane, the big size, then the basic Robbins, the middle one, then pockets Robbins. I don't read pocket Robbins. Then for pharmacology, I'm still figuring out what textbook to use. I like Schambach, just that Schambach is very condensed, it's very summarized. Schambach, I like Cat Song's review, the review book, or not the main Cat Song and Trevor. The review book is actually a good book. Then now I'm even Leaping Court, so I'm trying to get into reading Leaping Court because that is one I even have as hard copy. Then for hematology is Martin Crooks, I guess, for everybody. Then that is for chemical part. Sorry, for chemical pathology is Martin Crooks. Then for hematology, it's Hofbrand. A lot of people recommend Hofbrand. Hofbrand is a good book, but for someone starting out hematology, I think one book I would recommend is Nyack. Is Nyakkak. I think that's how it's pronounced. Nyack Review of Hematology. Is that one is very summarized, but like I said, Nyack Review Book of Hematology is just to give you a bit of a bearing of what is happening before you go on to read Hofbrand. Because like I said, Hofbrand is still book of choice, but like I said, it's for me, I felt like it had too much stuff, so I had to start with something small, then grow into Hofbrand. Then for microbiology, there's Microbiology Made Ridiculously Simple, but that's not what I'm reading. For microbiology, I haven't really found a book yet, but Levinson is a good book. Levinson's textbook. Then they say there's Essential Microbiology, which is also good, but I recommend Levinson. Then Microbiology Made Ridiculously Easy. I read Microbiology Made Ridiculously Easy during the break, and it was really interesting to read. So you can also try that too. Yeah. So thank you. I hope that answered your question, Francis. Thank you so much for joining my live. I really appreciate each and every one of you for sticking around with me till this time. I really, really appreciate. I hope to go live more. Maybe next time I'll give prior notice so that the live doesn't just happen abruptly. But thank you so much. I've spent like 1 hour and some minutes with you. Yes, it was, but I couldn't get all their names. Okay, maybe should I don't know if I can type it, or maybe I would have to do maybe one of my vlogs or sit down videos. I'll have to talk about them. What could happen is when I end this live will be made available as a video, so you can actually like watch up to the like move the bar up to this point, then reduce the speed at which I was talking, then get the names for yourself. I think that would help. Or in one of my vlogs, I will just talk about them. Yeah. Thank you so much, guys. I think I'll be ending the live here because I have to go. This was really fun. It was really, really fun, and I think I will do this more often. Thank you, guys. Have a lovely evening. I wish you all the very, very best, and happy new month in advance. Thank you.